Welcome to Cradle and All, a podcast hosted by sisters Renita and Christine to educate, inspire, and connect with other mothers. Every other week, listen as we discuss topics related to pregnancy, raising children, and balancing motherhood with other aspects of womanhood. Whether you're relaxing, juggling tasks, or even breast pumping, join us as we figure it out together.
Hi, everybody, and welcome to Cradle and All. We're so excited.
So excited for the first episode.
Yay, we finally made it. This has been a long time coming, a lot of conversations, and just, finally getting started is exciting. So thanks for joining.
Thank you for joining. So we are going to be talking all about breastfeeding and just nursing and feeding your baby.
Yeah, cradle and milk, which I think every mother at some point, every mother has to deal with milk at some point in their mothering journey, whether it's formula or breast milk with some form of milk. So Why not start with that?
Well, first, before we get into that, let's talk about why we want to do this podcast. So we've been talking about it so long. So why are we here?
Yeah, that's a good point. So we are here because we are moms, we're sisters, and we also, at least for me personally, I began my motherhood journey, it felt like very abruptly. I had experienced a miscarriage with my current husband, and then while I was engaged, got pregnant. And so we were like planning our life, and next thing you know, we have a beautiful child on the way, which we were very excited about. But I felt like I was just thrusted into motherhood very quickly. And I found myself trying to figure it out on my own a lot. But luckily, my sister was pregnant at the same time as me. So I leaned on her a lot for advice and just like figuring it out with somebody else who was going through it at the same time. What about you?
Yeah, like for me, I deliver babies for a living and I'm with pregnant women all day, every day, which I love. But there is such a difference between coaching my patients and being there for them in their situations and being a mom in real life as the actual mom. So one of the first things I struggled with was breastfeeding. And I was like, oh my goodness, I was encouraging my moms and just really strongly pushing them to breastfeed. And little did I know how tough it was. And that was my first introduction to realizing that motherhood isn't always what you think it's going to be. And I was one of the first of my friends to have kids. And me too. Who do I ask? And what do I do? And hearing some of the same things from patients and friends over the years, realizing that we all are kind of going through the same things, but not everyone's talking about it. So I was like, Christine, you need to get on this podcast.
That's true. And I also was one of the first and still am of my friends to have children. And I was pretty I wouldn't say desperate, but I was going kind of all over looking for mom friends. I went to this app called Peanut, which, nothing's wrong with Peanut, but I call it like a dating app for mothers because you go there and you basically match with moms and then you go hang out with them. So I really wanted to build a community of moms to talk about things. And I met a good friend through that. But this podcast was born out of that desire for a community of moms to really have a place to go to answer questions and to go through it together. Because sometimes motherhood can feel isolating. Even this week, I felt kind of isolated. My child went to daycare for the first time. And,
oh my gosh.
Yeah. And I felt very sad. And honestly, I felt kind of alone. My husband, he was okay, see ya. He's not emotionally care as much.
But, it's Bryson. My husband's name is Bryson, and he is like, great, we get to drop them off. Great. Off they go.
Yeah.
He's like, you want your kiddos with you.
Right. I was like, wait, but he's just so little still. He's a baby. We're going to leave him with strangers. So yeah, all that to say, this is just a safe space for moms to just hear other moms who have been there and who are going through it too.
Yeah. So join us.
Mm.
Well, Christine, let's get into it. Tell me a little bit about what nursing and pumping and breastfeeding life has been for you this week, because it's the first week of daycare.
Yeah, this week, as I sip on my mother's milk tea, which honestly, I don't think it works. It doesn't work very well for me. I've been on those blogs and stuff trying to get my supply up. And anyway, that's a conversation for another day. But maybe that's a part of this conversation because my son, he's 6 months old. And this week, actually today is his official 6-month birthday.
Happy birthday, Dallas.
No, Dakota.
Dakota. Oh my God. Happy birthday, Dakota.
Dakota's 6 months. Dallas is not 6 months. No, but Dakota went to daycare on Monday, and it's Wednesday when we're filming this now or recording this. And so I have been exclusively nursing since he was born, which I really loved because, with COVID, I'm home and he was home with me. So I really just leaned into nursing, which I really enjoyed. I really loved nursing him. And it was like really freeing. I didn't have to be connected to the pump because I do want to nurse and provide breast milk, but I hate pumping. And so what I'm finding, at least this week, is that now that I see what's coming out, it's not a lot. Before I didn't see it. I was like oblivious, like, oh, he's getting what he needs. But now I'm like, oh my gosh, my child has been starving because he's only been getting 4 ounces a day.
But do you feel like that pressure is there because you're seeing the amount of milk? Or were you feeling like he wasn't getting enough when you actually were nursing before?
I think he was getting enough because, when they're hungry, they let you know. So I'm actually kind of confused. I'm like, if he had been hungry, he would have been fussing. But why, when I pump, is it so much less than when I actually was nursing him directly? So I feel like that this week is a challenge, and it's the reality of providing him with milk and getting him what he needs. So we actually, a couple weeks before he went to daycare, I knew he was going. So I was trying to find the perfect formula because I felt like I wasn't going to have enough. So and also my sister, Renita, who's here, she is like, oh my gosh, she has more milk than like a dairy farm because she supplied me with enough to last me for like the first 6 months to supplement, but we had no more of that. So our journeys clearly are different because I don't know how we are sisters, but you have a dairy farm and I have like nothing.
It's so crazy. So let's just take it back way to the beginning because you were like, I exclusively nurse and I exclusively pump. So I don't love pumping, but I have to because Russell, my youngest son, who is now 8 months, he never got the hang of latching, but I make an extraordinary amount of milk. Like I've donated it on Facebook sites. Christine's used it. I'm still have a ton for Russell, but I just did not get that experience of nursing with Russell. But with my oldest son, I did exclusively nurse and absolutely hated it. So going way back to the beginning, for both of your kids, Christine, Dallas and Dakota, you've nursed. And you did not have some of the challenges I had, but what did you like about it? And did you have any challenges with it?
Well, yeah, you know what I like? Of course, there were challenges. Even with Dakota, there were challenges. With Dallas, I feel like some of the more regular challenges as far as, at the very beginning, it's painful. It's uncomfortable. He got thrush also in the beginning.
Oh my God. And I got thrush.
Yeah.
Which was that's a whole nother ball of worms. Ugh.
And I'm surprised Jackson didn't get it.
Yeah.
But you had it. And then with Dakota, there were some issues like I had some engorgement. I remember at the very beginning, I was so engorged and I felt like something was wrong because it lasted for days. And I was like, and no milk was coming out, but I was so engorged and in pain. Remember?
I remember that. Oh, that was weird.
And I called the lactation consultant. She's like, just give it time. And it went away. So those were challenges throughout, but they were very short-lived. The biggest challenge with Dallas and Dakota was the supply. I feel like with Dallas, I was traveling when I was nursing him. So I literally traveled the whole first year and I tried to provide milk for 1 year. So the biggest challenge there was finding places to pump at the airport and keeping my supply up while traveling, because being away from him and transporting the milk to different states, that was very difficult, but I stuck with it, and it lasted until about 9 months until I dried up. You know what? But really, I feel like the joys outweigh all those challenges, because, oh my gosh, there are so many. It's difficult, I feel like, to breastfeed. It can be really challenging.
I literally did not realize how hard it was going to be, because for me at my job, I see patients when they deliver their babies in the first few days of learning how to latch and get the hang of things. And then by the time they come in for their 6-week visits, they're either a pro and continuing on, or they had already stopped and they were done. That first 6 weeks in between, I had no idea. So with Jackson, the first 8 weeks were literally hell for me. Like, every day I was like, I have to nurse this child. Like, I have to get him.
Why was it so bad?
I mean, I felt like I had to do this one thing. It was the one thing I can do for him, like give him this milk. But I was having such pain with my latch. And I probably should have seen a lactation specialist sooner to make sure that the latch was good. But because the latch was not good, I had cracked nipples. I couldn't even be in the shower without putting my hands over my nipples, because the water would kill. So with every latch, there were tears. And then the first few days, I didn't even make milk until day 5. And so I'm pumping like a crazy woman, trying to get my milk to come in, the pain. And then I probably had a little bit of postpartum depression for all I know. It was just a crazy time, just with no sleep and feeling like I wasn't doing good enough. But somewhere after 8 weeks, we found our rhythm, and I ended up for a full year.
You really were patient, because after 8 weeks, I would have thrown in the towel. I would have been like, okay, this isn't going to work for us. Although you're right. I feel like it feels very rewarding to be able to provide your kid with milk.
Yeah.
For me, at times when I started to feel like I wasn't going to be able to do it, even right now, drinking this mother's milk tea, I feel like I have to do this. It's especially with him in daycare. I feel like it's one way that I can continue to connect with him when he's not with me. And that when he gets home, I know we'll be connected instantly, because he'll nurse and we'll have that bond again. But, that's my experience. I know for you, with Russell, you're not nursing him directly, because for me, my favorite part is the nursing. The milk is great, but I really actually like the act of nursing directly. How do you feel comparing Jackson, where you nursed him directly, and you also pumped, but compared to Russell, where you pumped exclusively?
I do miss it. I mean, I really do. So with Russell, he was born premature and was in the NICU for 5 weeks. So when you have a baby in the NICU for the first, I guess it depends on the baby's age, but for the first few weeks, I wasn't even able to breastfeed. So one of the highlights of the beginning of my breastfeeding nursing journey with him was that I got to start practicing nursing, and he seemed like he was doing such a great job when we were in the NICU, but he's a small baby and has to build up his strength, and never really got the hang of nursing. So for the first, maybe 10 weeks. Oh no, I know for sure. First 12 weeks, I did this thing called triple feeding to get him to learn how to nurse, and it did not work. And it was such a disappointment.
What is that? Wait, I don't remember.
For those of you out there who know what triple feeding is, you probably feel like a crazy woman like I felt. But it's where you put the baby on the breast to get them to learn how to nurse. Then if whatever they don't take from you, the second part of it is to give them a bottle of your expressed breast milk. And then the third part is for you to pump afterward. So these turn into hour-long sessions of nursing, because you're putting baby on the breast and trying to get that going for 20 to 30 minutes. Then the baby's taking a bottle for another 10, 20 minutes. And then you're pumping for another 20 minutes. And next thing you know, it's been an hour and a half, and baby has to eat again in 30 minutes. So I did that for 12 weeks.
Wow.
And it was me giving it my all, trying to get him to nurse. But I had to give myself a little grace this time around, because I felt like I had such a tough experience with my first. And this time around, I was like, you tried your best.
Yeah.
He's going to get your milk, and that's all that matters. And looking back at it now, even if he didn't get my milk, maybe it wasn't going to be that big a deal. But there's something about the guilt I had of just feeling like I had to give both of these kids breast milk.
Mm-hmm. Yeah, that's so real because, and I can imagine, especially with the child in the NICU, you feel, and what you hear also, and even in your profession, because I went to my sister's practice, which they're really great physicians, really awesome. I had a wonderful experience with both deliveries, and the prenatal care. But I think it's very widely heard that you should breastfeed your child. Breast milk is the best. And so I think there's that level of pressure, but then also personally, like when I started to dry up, again, that example, my husband's like, oh, looks like we're done. I'm like, don't say that. No, we're not done. Because I felt like I just feel like I have to do this. Like you're saying, it's like, I just have to do this.
It's so weird. Like today I was talking to one of my partners at work and I was like, oh gosh, 4 more months of pumping. I can't wait to be done. And my partner was like, then just be done. Like just give the baby formula. And I was like, well, no, I can't. I don't know why. She's like, why can't you? But something about it. And also for me, this sounds ridiculous saying it aloud, but both of my kids were born by C-section and I really wanted vaginal deliveries, blah, blah, blah. But I'm like, well, I didn't get to birth them the way I thought I would, but this is what I can do. I can breastfeed. And it's just ridiculous, but it also feels good to be able to do it.
Yeah. But at the same time, nothing is wrong with not doing it. Like our mom did not breastfeed us and I was premature. I was born at 2 pounds. And my mom was like, okay, and she did not breastfeed.
Mom told me she gave you cow's milk starting at 6 months.
What?
She told me that the other day.
Oh my gosh. That is really gross.
But you're here and you're amazing. So
that's the thing. It's like nowadays, the people, all the older generations, like there's so many rules now. We used to sleep on our stomach. Let it be known. Like we used to. And my husband always puts the baby on his stomach. I'm like, don't do that. He's like, we used to be in our stomach. He's like, you know what? You're right. But they say don't do it. So don't do it. Just like the whole breastfeeding thing. It's like, we'll be fine.
Yeah, that's true. But, I also think my experience with nursing has given me a better perspective to talk to other moms and other women that I've been around to help them to realize that it doesn't have to be perfect. If you just want to use formula, perfect. That's just fine. No baby's going to miss that. Or if you are beating yourself up, waking up every 2 hours, every 3 hours, just know you don't have to do that. And you are not alone if you feel like you have to do that. Because we all kind of go through those moments of feeling like you need to do more and you're not alone in that feeling. And it's okay to let go.
Mm-hmm. Well, speaking of doing more, like I said earlier, this week, Dakota's in daycare, and I do feel like I need to keep my supply up because you have such a good supply. Like, is there anything that you found that helped you with maintaining your supply at certain times? I know I've tried a couple of different things. I'm just curious, like, have you had success with anything?
So it's crazy what my supply is like. Honestly, if you guys were to look inside of my freezer, you would think that we only drink breast milk because my deep freezer only has milk in it dating back to like January of this year. My regular freezer, one shelf is just of breast milk. And I honestly think the reason my supply got the way it is in both pregnancies has to do with how I established it in the beginning. I was somebody who was always pumping or nursing every 2 hours for the first 12 weeks. And so I just continued to build that supply. But if you think about it, to be able to do that, you have no sleep. You probably are going a little bit cuckoo like I really was, but my body had just maintained. However, I completely know that everyone's body is different. Like some people can do that and still don't make enough milk. So I don't really know why, but I do have moments where my supply drops a little bit here and there. And I tried some of those teas, but like Christine just said, I don't know if they work that great.
Mm-mm.
I think oatmeal does help. Every time I think my supply is dropping a little bit, I eat oatmeal for my morning meal, and it does help.
Okay, I had oatmeal for breakfast. I can't figure it out. I think either I'm not logical enough to connect the dots of okay, today I did this and that happened. But as far as, I think that's a big point. What you did at the beginning probably does have a big impact, I would imagine, because thinking back to my beginning, especially with my second child, I was very much more laid back, let's say. With Dallas, I certainly pumped, like you were saying, I pumped at least once a day because I was preparing to build a supply. With Dakota, I just leaned into nursing exclusively. So I did nothing to build a supply. And there were weeks that went by that I didn't pump. And so that may have something to do with it. But on the same hand, I did nurse on demand. And something that was unique about Dakota, my youngest, compared to my oldest, I always felt the letdown. With Dallas, I never felt a letdown. But with Dakota, like every time it was getting close to nursing time, or if I skipped or whatever, I would start to feel the tingling and the cramping, which I was like shocked by that with Dakota because I never really felt that with Dallas at all.
I feel it with both my kids. That's interesting.
Really?
Yeah.
You still do?
Yeah. Mm-hmm.
Oh my gosh, I don't anymore.
Okay, I have some more tips now that I think about it for milk supply. So I mentioned the oatmeal. I also power pump sometimes. So if my right boob is like a slacker, everyone's got a slacker boob. Mm-hmm. My right boob makes like 2 ounces less than my left. So sometimes I'll power pump on my right side. But a tip, that basically means where you pump for 10 minutes, stop for 10 minutes, pump for 10 minutes, stop for 10 minutes. You do that like 3 or 4 times. And sometimes that will increase my supply because it's kind of trying to mimic cluster feeding. I also, if I think I need to increase my supply, I will increase the amount of time that I pump or increase the number of times a day that I pump. So if I usually pump for 15 minutes, so I may instead do it for 20 minutes for a few days. Or I usually pump like 4 times a day, something like that. I may change it to 5 or 6 times a day just for a few days to increase my supply. And the same could go for like nursing, like if you're not a pumper. Mm-hmm. But those.
So I've tried the power pumping, and I was wondering. Not even the power. No, but not the power pumping. I meant like I've tried extending my pumps longer. Mm-hmm. But I noticed that as I'm doing it, after about like 15 minutes or so, nothing's coming out anymore. If you noticed that was happening for you, would you stop or do you keep going?
No. So really, I try to do pump for another 5 or 10 minutes after the milk stopped. If I ever got to the point that I wasn't having any more. Mm-hmm. If you have the time, like who has the time with a toddler running around? But
I do because I work from home. Yeah. So I can really just do it as I work. That's interesting. I'm actually just down to 1 boob now. You said you have mine's completely, it's beyond lazy. It's just
so nothing comes out of the other side at all?
I don't even pump on that side anymore because.
Oh my gosh.
No, I do notice that like if I squeeze, it'll be stuff coming out, but I stopped because I noticed that I was pumping when I went. So I went to Mexico this summer and I was pumping there. And that was like the first time ever for this child that I had pumped for so long. But I noticed that when I did both sides, one side, nothing was really, it was like drips. I could pump for 20 minutes and it'd be like less than an ounce all the time. So I was like, why am I putting my boob through this? I'm not going to do this anymore. So I just stopped on the one side. And now I just do the one that is producing more milk.
So are your boobs lopsided?
Yes. Yes, they are. I told you, it's been a journey. And then so on top of that, something else traumatic that happened with the one boob that I had. My child somehow like slashed my nipple with his gums.
Oh, I forgot.
So then I was down to 1 boob and 1 good boob and 1 good nipple, but they were both on the opposite sides. So yeah. But you know what? I persevered through that. I really did. I got a nipple shield. I tried that. That was something else that I tried.
Oh, that's smart.
Was the nipple shield. But I think that made it, he thought that was a chew toy at that point. What is this plastic?
Oh my gosh. Yeah, all the things that people go through. Well, so with Dallas, how many months did you nurse for?
So with him, I nursed for 9 months. At the end, it really was like drops in a bucket. Mm-hmm. But I kept going. Even with Dakota now, when he goes to daycare, when they both go to daycare, I will give them at least 1 bottle of breast milk, even if I have to mix the breast milk with formula or whatever. Like at least they'll get that 1 bottle of breast milk at daycare. So I did that for 9 months until really nothing was coming out anymore, and then I just stopped. But I know even Jackson, you went past a year, didn't you?
Yeah, I went about 13 months. Once I got to a year, I was like, I'm done. I can't wait. Countdown to 1 year. But then it was like, we're going to be done with this. Like I really felt sentimental about no longer nursing. So I was more slow to wean off than I thought. But it is such a bonding thing. Now it's interesting though, because when at least for me, when I started off nursing, particularly with Jackson the first time, I felt like I was tethered to this child. Like I felt like I could not go anywhere or do anything without thinking about his eating schedule. Bryson could leave and be like, I'm going to the gym, I'm going to work, and not have to think once about like, okay, I'll be back in 3 hours. And that was really tough for me. Like I felt like I was only getting the baby when he was crying. And then it was always time to eat. I felt like I never had a minute without it almost being time to eat again. Did you ever feel like that?
Oh my gosh. Of course I did, especially with the exclusive nursing. That was even more exhausting because unlike with bottles, you can give your partner and say, you do this feeding. But I really, because I was just so adamant that I was not going to pump, we didn't really have bottles like that. So I felt like he was always sucking. And every time he was around me, I feel like that's all I was to him was like a big boob. Because whenever he was around me, he was, doing the whole, those signals that shows that he wants to eat. So he was always nuzzling, always turning his head to the left and right. And I felt like that's all he saw me for. And I kind of was a little, I don't know, it made me feel some type of way because my husband, he could play, but every single time, even if I wanted to console him, even if like for anything, it's the middle of the night, he's upset and I know he's not hungry, but he still is around me and he wants to nurse. And yeah, I certainly felt tethered, which is interesting because my husband loves to go out, loves to have fun. We both do, actually. That's it's one of the reasons we're well matched is we like to have a good time and have fun. And he can continue doing that, throughout the pregnancy. Of course, you're a little limited in what you can do. And then it's COVID on top of that. And then now you're nursing. And, when I do go out, I still felt like you plan your day around nursing. Oh, I have to get back for this, or I have to pause in the middle of what I'm doing to go into a car, to go somewhere to pump. It's definitely a tethered feeling for sure.
Oh my gosh. I think about all the places I've ever pumped, like literally a million places. I think of all of Atlanta has seen my boobs because I pump in the car. I pump in between trips to places, like, because it's like you're on the schedule. You have to always be ready. Even if you are nursing, not pumping or what have you, like, you just got to whip it out and get going. And
that's true.
You got to do what you
imagine me traveling for work. I literally have pumped probably in like 10 states because I remember one time I pumped in a hotel lobby on the floor and a woman was cleaning. She was keeping the door protected so no one came in, but I literally was hunched in a corner. And thank God for these portable pumps because they've made all the difference. And I realized just the other day, Renita, you told me that I had been using it wrong for years.
The pump settings. Oh my gosh. First of all, so we both use the Spectra. And this pregnancy, I'm using the Spectra. Last time I used the Medela. But the Spectra is like kind of complicated with all the different buttons. So I had to like figure out the best way to make it work, considering that I'm an exclusive pumper. But yeah, there are lots of techniques that also help with your supply.
Yeah, I think that's another technique that you told me about that I tried. Yeah. Using the settings, like increasing the different suction.
How fast the suction is and things like that. Yeah.
Which I had no idea. For years, I just turn it on to the same exact setting and go. But now I'm adjusting it and all of that.
Oh my goodness. So yeah, pumps. The other thing about pumps that is so annoying is washing the bottles. I feel like when you're exclusively nursing, you just put the baby on, take the baby off. With pumping, it's like wash the pump parts, wash the bottles, sterilize. I mean, it's just madness.
So do you still sterilize?
Well, we use our dishwasher. Literally, I was like, how did I go through an entire full year of hand washing bottles with Jackson. We hand wash everyone, put them in those little Medela bags.
Yeah, I still do that.
How?
I still do that. And those bags don't really hold a lot of bottles. So you end up doing like 2 or 3 different goes. It is a lot for that part too, with the sterilizing and the washing. You know, I even bought, so this time around, you know, with your second child, you try to do things much easier. So like you're saying, putting in the dishwasher, I got this dishwasher safe. You put it in that dishwasher safe container.
Yes. The safe container for the nipples.
Yep. I got that too. Because, you know, I remember our mom would say, like, make it easy for yourself. And she watches the kids a lot. And I think she's even gotten this, making it easier down to a science. She like has, and I think she would do this unless, maybe she does. When the kids are there, she'll like bring the bottles up to her room. She'll have the bottle warmer in her room. And she literally just tries to make it as easy as possible. I still keep things separate. I never got to that point. But I feel like with your second, you really learn a lot of lessons compared to the first one.
Get 2 of everything. We had 2 bottle warmers. I have like 3 pump pieces so I can just alternate since I have to pump so often. Like just whatever you can to make life easy.
And you're getting ready to travel. Have you started planning pumping for traveling?
My gosh. So we're going to the beach this weekend. We have waited all year to go because of the pandemic. So this is going to be our first trip to the beach, let alone with 2 kids. And as I'm thinking about all the things we have to pack between pack and play and toys and everything like that, I'm like, what am I going to do with my milk? So part of me, because I have a pretty good supply, I probably can just get along with just pumping and giving him as I go. But also too, I'm like, I want to take some of the frozen milk, and then how do you store it?
Yeah.
So I think we're just put it all in the cooler. I mean, I don't know.
I don't know. It's not going to stay frozen when you travel.
I know. I mean, these are the things I have to figure out. Gosh.
Yeah, I don't know if that's going to work.
Yeah. But I mean, my plan is just to pump as we go along. Sometimes I worry, like, what if I ever run out of milk at a time? And can I just give him formula? Is he going to be used to formula? What was it like when you gave Dakota formula for the first time? Because she nurses, but also has introduced a little bit of formula.
Yeah. He has formula because I don't have enough breast milk right now for him at daycare because I'm not exclusively nursing. So that was an actual journey as well, because with my first child, what the first type of formula we gave him, he liked, which was the easiest for us, which was the one that was already liquid form. But with Dakota, we kept trying to give him that. Every time we would try to give him a bottle for like a dream feed or, you know, the overnight feed just to keep him a little heavier on his belly, he never took it. He would never drink that liquid formula. So then I did some research and I realized that it finally connected with, in my head, I was like, you know what? He needs some type of breast milk-like formula, something that tastes a little bit more like breast milk. And I don't know about y'all, but I taste everything that I give my child. So I've tasted the formula, and that liquid one is gross. It's really nasty. But the one that he's drinking now is actually powdered, which for a long time, I don't know why I thought powder was it was worse than liquid. I was like, I wouldn't drink powdered milk.
Yeah.
But he actually really likes this powdered milk, and it does taste more like breast milk. It has like a little sweetness to it. And he really likes it. So we had to figure out, like, we got this organic Earth's Best breast milk that he does like. But, you know, it has changed his digestion and, you know, his poops are a little different and he was a little gassy for a bit.
Was he?
Yeah, he was a little gassy, a little farty, but he's good now.
You know, we had to supplement with formula for Russell when he was first born because he was, most NICU babies, I suppose, they recommend that you add a little bit of formula to help them grow. And Russell hated it. Like, he had the worst reflux you've ever seen. And it was so sad. He's like arching his back and crying and having projectile vomit. So I think it was because he was so young and it was like a really thick kind for babies. But I think that experience makes me a little bit nervous about introducing any formula because I'm like, what if he does that again?
There's so many different brands, though. There's a lot out there because when I realized for Dakota that he was going to have formula and he didn't like the kind that I had, I just started researching different brands, and there's a lot of different kinds. There's kinds that are easier on their stomach, and there's fortified with iron. And there's brands overseas. There's a lot of options out there. So you'd be able to find something for him if you have to go down that, which you won't have to go down that route because you still have a deep freezer full of milk.
Oh my God, that's so true. Well, here's hoping.
Yeah.
So how does Dontrell help or not help with your experience with nursing? Like when I think about me, I think about the Russell, for example. Bryson has been really helpful with the bottles since I have to do all the pumping. He doesn't do all the bottles, but he's really helpful about washing or helping make sure that we keep on track with those kind of things. And then I think he was really good emotional support when I was going through the struggle of breastfeeding in the beginning with Jackson, because I literally was a basket case. I just was feeling so overwhelmed emotionally with it. So I think he was really supportive in that standpoint. But what about for you and Dontrell?
He's been really helpful. I feel like we're just a team when it comes to everything with the kids. The most helpful thing with Dakota right now, and I only speak about him the most because it's happening in real time, when it's overnight, especially with the nursing. Dakota's in his crib and he's been there since he was 3 months. And even before then, he was we did the whole bassinet thing. But Dontrell, we made it like some type of unwritten pact that he would always get the baby in the middle of the night. So even though I'm nursing, he will always go and get him and bring him to the room. So that's one luxury that I never have to like put my feet on the ground, never have to get up. He'll just deliver the baby to me no matter the time of night. And which has been really great because I feel like with nursing exclusively, and even if you're pumping, it's a lot of waking up. As you know, you Renita, you woke up to pump every 2 hours for 12 weeks. So it's a lot of waking up. So I really appreciate that. And actually, this is something else he probably doesn't want me to tell anybody. But when we were trying to get Dakota to sleep in his crib, because he kept waking up to eat, and we realized, like, wait, this app says that he should be sleeping through the night at 5 months. Why is he still getting up? Dontrell literally slept in his room for like a week on the floor.
Oh,
and
he
would get up. Every time the baby cried, he would get up and just kind of pat him and then go back to sleep. Because like I said earlier, every time he came to me, even if I just want to console him, he thought it was time to nurse. He started freaking out because he would be like, I need milk. So Dontrell for a week slept in that child's room on the floor, and it worked. He's sleeping through the night finally.
Oh my God, that is dedication.
Yeah.
Oh, wow. Yeah.
Yeah, you and Dontrell are dedicated because I would never do the pumping every 2 hours for 12 weeks.
Oh my God. So I have a crazy story about when I had thrush. You've never had thrush before?
No.
Oh yeah. And we both have never had mastitis. With my first pregnancy with Jackson, I had thrush, which was the absolute worst. So I mentioned the first 8 weeks of hell. In that 8 weeks, I started feeling, I had been experiencing the nipple pain for quite some time. So I was used to it. I knew when Jackson latched, it was going to hurt, and I was bearing through it. But this was different. It was like somebody was taking a lightning bolt and just going through my breast, or taking a knife and stabbing me. And it was so intense. It was just randomly, not when I was nursing. And I was like, what is this? I would take ibuprofen and nothing would help. And I just was never comfortable. I never had a patient complain of this before. I'd never seen it. And I talked to my partner about it. She's like, oh yeah, that's thrush. And I was like, oh yeah, jogging my memory back, thinking about reading it in books, but never having had a patient experience it.
Mm-hmm.
So I had to take Diflucan, which some of you may know is the medicine you take for like a yeast infection. You usually take that once, but I had to take it daily for 2 weeks. And finally things got better. But anytime that you may have thrush or your baby has it, you have to sterilize everything, and your baby may need to get treated in case the baby has it. So we had to go in and sterilize the toys, the nipples, the pacifiers, like anything that would be in his mouth. And it was just so stressful and traumatic. And luckily I got through it, but the pain was excruciating for so long.
Oh my God.
I know a lot of women out there get like mastitis, which is a breast infection, and it's like lots of high fevers and chills. But this is another thing that sometimes can happen, especially in the beginning phases of nursing.
Yeah. Well, what actually causes it? Do you know?
So sometimes, especially if you get cracks on your nipples, then extra bacteria and yeast can overgrow. And for me, it got into the ducts of the breast, which is why I had the sharp pain. But sometimes you can get it just on the nipple and get red, painful nipples, pain with latch. And then babies can get it too, again, if like extra of that yeast grows on the nipple or the pacifier or from your own breast. Babies can get it in their mouth and they get this white plaque, and it can be painful and make it hard for them to eat.
Yeah, Dallas had thrush.
Oh,
and the way we knew he had it was because he had that white coat on his mouth, in his mouth. And, you know, babies already, especially newborns, they already have that white coat in their mouth. But this seemed very thick. This was thicker than normal. And it would not scrape off. You know, you can put a washcloth on their tongue and nothing was making it go away. And so when we took him to the pediatrician, just for their regular, you know, they're going frequently at the earlier stages, she said that he had thrush. So I believe, if I remember correctly, I had to use a nipple shield for a while.
Yeah.
So that I didn't get it. So it didn't transfer to me. But I don't think we gave him anything for it. I think it just cleared up on its own, but I don't believe.
Oh, you did. You had to give him some like mouth drops, I think.
I don't remember.
I do remember. And that's usually how you treat it. You do have to give them something. But I remember you giving it to him.
Okay.
Yeah.
Well, yeah, it was just, and if you are concerned about I don't remember last week. But no, I think the thing that's different about thrush is the thickness of that coating in their mouth.
Yeah.
It's super, super thick on their tongue, on the roof of their mouth.
Yeah.
But you also had a clogged duct. I've never had that before.
Oh my gosh.
You've had that too, haven't you?
I've had too many clogged ducts. So, you know, sometimes you can just get this intense pain in the area and it just feels like a ball and so things I like to do is like rub that area out with warm water, like in the shower, but literally it can feel pretty uncomfortable. And I even find that if I like wear a bra that's too tight or something like that, it can make it worse or cause them. Mm-hmm. So, you know, that's annoying. God, women go through so much.
I know. Yeah, that is a lot.
It is time now for Rapid Fire, where we answer questions related to our topic of today, which is everything breastfeeding and nursing. So I'm going to say a topic and I'm going to respond, and then Renita's going to respond. We're going to say our thoughts about these different topics. You ready, Renita?
Yep, I'm ready.
Okay, so first one, breast milk or formula? For me, definitely I would prefer breast milk, but at this point, take whatever we can get down to one side. So I'd say formula at 7 months.
Breast milk for me so far. We'll see how we go. I'm at 10 months, but yes, breast milk it is.
Okay. What about pacifier or no pacifier?
Pacifier for sure. Russell loves it, and hopefully, you know, he'll be out of it soon, but pacifier.
For me, it's a no. It depends on the kid, actually. Dallas really liked his pacifier. He liked his little wubba nub with little stuffed animal attached, whereas Dakota won't have any parts of that. Best place to pump?
Oh my gosh, in the car. That's like the best multitasking. And still hands-free.
Wow. For me, it would be in my office at work. Like when I work from home, so I'll love doing it at work. I can multitask also, work while pumping. What about bottle brand? Do you have one that you love?
So I've used Dr. Brown's and Avent, and I love Avent all the way for both my kids.
I use both of those too. With my first, I use Dr. Brown, second Avent. And Dr. Brown, I really don't like them. It would leak all
Yes, they leak. It's annoying.
It's so annoying. What about the best way to increase milk supply?
Power pumping. Well, for me, since I'm pumping, but that's pumping 10 minutes on, then off, on and off.
Ooh, I would say increased water intake and oatmeal. Without fail, yes, every time I have oatmeal, I always have it increase. Even though they always say it's not scientifically proven, I'm like, it works though.
Oh, yeah. Yeah. And increase how much you eat. That can help too.
Oh, yeah. Treatment for cracked or sore nipples. For me, I had that experience like in the very beginning with Dallas, and I used lanolin and breast milk.
Yes, I would say breast milk. I would just express a little breast milk, put it on, and it helps.
Okay, what about this? Taste your own breast milk, yes or no?
Yes.
Yeah, me too. I like to taste everything I give my kids, including my own breast milk.
Now, I wouldn't drink it all the time, but I mean, I've tasted it before.
Yeah. I especially tasted it because I'm giving him formula. We had to find the most breast milk-like formula. So I'm like, well, what does breast milk taste like? At that point, I already tasted it many times, but yeah, definitely. What about the age to stop breastfeeding? What do you think is the right age for you and your family?
When you want to, even though it's interesting if you want to go all the way to age 5, but whenever you want to.
I would say 12 months for me, because at that point, I'm just ready to move on. And last one, best breast pump brand.
Ooh, this one's hard. I like Medela, but the Spectra has the best output, so I like it. I'd say that.
Yeah, I would say Spectra too. There are 2 Spectras. I use Spectra, the pink one, with my first child, and then now I use a blue one. The blue one's hands-free, basically.
I like the blue one. And I've never used the pink one, but the blue one's great, hands-free, no need to be plugged in. I just wish it was smaller so I could just put it on my waist or something like that. But
in your car as you're driving.
Yeah.
All right.
So let's say, you have to give advice to one of your, you have friends who just had children.
Oh my God, I've had so many friends who had babies recently. Yes.
And I've had a friend who had a baby, and I was like telling her things she probably didn't even want to hear, a baby recently. But what advice would you give one of your friends about nursing or breastfeeding milk?
Oh my God, where do I begin? I mean, honestly, I think my number one bit of advice is to know that there is no right or wrong way to do it. If you never wanted to breastfeed a day in your life and you just want to do formula, you go, girl. Like, that's you. Or, if when it comes to breastfeeding and going through that whole experience, it is going to look different for you than it may look for somebody else. And I really realized that when I saw your experience with nursing, Christine, because I just feel like there were so many tears for me. Remember that time you came over and she was getting married and we were going to go wedding dress shopping, and I completely forgot. The dog had pooped in the corner. I couldn't get Jackson to latch. It was just so many tears with breastfeeding. I just had such a hard time. And then I looked at Christine, and her experience was so easy. I was waiting for the day for you to be like, oh yeah, I'm having a hard time. And you never did. I was like, oh, okay. Me.
I did. I just didn't say it, but I definitely did.
But my advice would be to know that your experience may look completely different, and it's not because you're doing something wrong. It just knows that that's your experience, and it's okay to not want to do it. It's okay to give up. It's okay to not give up and go hard in the paint and then end up doing wonderful afterwards. Mm-hmm. Just give yourself a little grace, because at the end of the day, you're doing awesome. Your baby's here. You're feeding the baby the best way that you want to, or the way that you know how. And if you are nursing or pumping, getting advice from other moms on tips on how they did it to figure out what's best for you. If you want to wake up every 3 hours and being on the schedule, or if you want to, do more on demand like Christine did, then that's okay too. But I think that's probably my biggest advice, because as a new mom or even as an established mom, there's always so many expectations about what we should be doing and what's right and wrong. And really, it's okay to do it how you want to do it.
Yeah, and that's so true. It really is okay. It is okay no matter, your way is the right way. Whichever way you decide is the right way. The advice I would give is to enjoy it. Enjoy it. It's only so brief. Our children grow so quickly in the first year of life and even the second year of life. And nursing is just a blip on the radar that they won't even remember. Even thinking back to my first child, when I'm nursing, sometimes, your mind drifts, your mind wanders. And I try to remember so many moments from that experience with my firstborn, and I've already forgotten so much about just those moments of sitting there with him nursing. You know, my son now is like, when I'm nursing, he's waving his hand in the air, he's grabbing at things, he's starting to look around, he's getting distracted. I'm thinking, oh my gosh, did Dallas do those things? Just trying to remember those exact moments. So I would just say enjoy the moment, enjoy the entire process, because before you know it, they'll be eating solids. They'll be achieving some other milestone. It'll be something, just a distant memory. So all of these challenges, I mean, these are the stories that you're going to tell your kids one day, you'll embarrass them with, the memories that will make you laugh later on down the road, or that, you know, you'll remember fondly. And so just enjoy the late nights, enjoy the thrush, the figuring it out. I think this is just, it's a good test, honestly. Breastfeeding is probably a good test of like figuring out being a parent, because all the things you have to figure out with breastfeeding is like a good test, probably some type of like hazing of parenting. Like, okay, if I can do this, I can figure out everything with motherhood. So yeah, just enjoy it, because it will go by. It does go by
so fast. And I mean, and even if you're somebody who your experience doesn't go exactly how you wanted to, if you going to breastfeed and you thought you were going to pump at work and it didn't work out, and now you're doing formula, think about those beautiful moments that you get to just curl up with your baby, just you and that baby in that moments with the bottle. Like, I think some of the most beautiful bonding I have with Russell is when we feed, and though I pump, he gets it as a bottle with me. And so, like Christine said, those are the most precious moments that you'll have. And at the end of the day, you may have these expectations about how you'll feed your baby, but take it from me, when they're 3 and begging for another graham cracker, like they're going to eat what they want to eat.
Right. All the plans you had. Now it's like, okay, chicken nuggets and
I just think about all the time I went into like hand making all his solids and making sure he only had breast milk. And now he's so picky with the things that he's eating. I'm like, ugh.
That's a conversation for another day, because I still make the solids from scratch. So even with Dakota going to school, he gets solids, and I still blend them up for him and all of that. And
that's a whole other conversation here.
Yeah. Actually, I need to do that once we're done. I need to go make apples for tomorrow.
Well, we are so glad that you guys were able to join us tonight for this conversation. We plan on doing this every 2 weeks. So every Sunday we'll have another release.
Yep. So cheers, Mama. Raise your glass.
Yeah.
To you.
Yeah, you're doing a great job. So here's to breastfeeding or formula feeding and everything in between.
Don't forget to subscribe to our podcast so you don't miss a thing. And leave us a review. You can also follow us on Instagram at the Cradle and All, or email us at thecradleandall@gmail.com.